the root cause analysis using the fishbone Ishikawa diagram. And this is the high-level result of our Ishikawa root cause analysis. We focus on the processes, we looked at the equipment, it works, okay, environment, and then also the people. In the next slide, I'll go more detail in each of these processes. Okay, so we started the patient journey. I will do this presentation as a journey. So patients normally start the journey where in the emergency? Triage registration, right? So we found that there were delays in the registration and in our triage. So we need to look, why was this happening? We needed to find these contributing factors. And we found there was lack of early intervention. So therefore we introduced the quick look nurse. We also found there was lack of support from our reception registration team. And we also tried to look why is this happening and how we can improve this. And boom, we trained them to identify critical symptoms from our patient with chest pain and stroke. So this really helped us to decrease our length of stay. We also looked at the delay in the allocation of beds. So we got our team together and asked, why is this happening? What's going on? And we figured out that majority of our patients with 4 and 5 we occupied the beds in the triage, in the ED. And the same process was happening for all patients in the triage. So we needed to do something. So we decided to introduce priority clinics, our fast-track clinics for category 4 and 5. And this really helped us. This helped us to free the beds in the ED, and patients were just in we have 2 fast-track rooms, so patients were directly there, we have a dedicated nurse and physician there. So this really also helped us. We also looked at other contributing factors, especially in delays in our diagnosis and treatment. We want our patients out of there. Ultimately, the most important thing is, at Sheikh Khalifa Hospital for Fujairah, patient satisfaction is number 1, starting from the ED throughout the hospital. So we needed to look at what's going on. So some of the contributing factors where we found like the lab tests, we're not getting to the lab on time. So we decided, let's make use of the pneumatic tube. Proper use of the pneumatic tube got our labs to the blood samples to the lab immediately. Also talking of stat labs. So we needed to work on that as well. We looked deeply into that, why the labs were late. Then we figured out also that we need to customize our capsules. Stat labs go in a labeled capsule, so the lab will be able to identify them. And the good news is, for the last 3 months, we have 100% tapped for our stat labs. That means all stat labs get to the lab within 10 minutes. Thank you. We also found some delays in the radiology team coming to the department to do the x-rays. So we decided to also investigate that. So with a few meetings with the radiology team, we came to the conclusion that we need to pre-alert them. So now in our ED, we pre-alert the radiology department using our duty phones. Okay, so this is a very interesting slide. So why interesting? Because when you do an analysis, you come a lot of problems. But this one was the one that led to most delays for our patients. This one, the communication between the ED physician and the on-call physicians that we consult to admit our patients. So we also looked at what's going on. But thankfully, thanks to Dr. Anwar, our CEO, thank you to our CMO, Dr. Hassan, that gave the ED physicians the privilege to admit patients. So this was huge. This was really this had a big impact, so that the ED physicians are now able to admit patients. So they have this privilege, and this really decreased the length of stay of our patients in the emergency department. I thought we'd get another clap, but Moxie. Okay, so thank you. We also, in the implementation phase, we had to train our staff, and here we focused on how we went to implement our ideas. And we had to do it in a control setting. We just could not do it any time of the day. We started with day, we went to night, and then 24 hours. Of course, every project has challenges, right? Even in normal life, we have challenges. So we had a few, but the most challenging ones in the challenge we had to train. We realized that training, just one session of training was not enough. We had to do multiple trainings. We also had this resistance from some MRPs because you know, admission. If we can have some H2O, please. Because I'm the last speaker. You saved the best for last, yeah? I'm just kidding. So challenges, there are a lot of challenges. So this is just a summary of all our actions that we did and led to the successful implementation of our project. I will not go through each one of them. And then we continue to evaluate our progress, and we compare our data with from the past and present. And this is my best slide. So take a look at this. Somehow my pointer is not working. We started to 23 patients, okay, and then we had 71%. Then we went to 72 in the second, but we maintained 90% after 2 months, okay. So that was a great achievement. And another thing, take a look at the volumes, okay. 23,501 in October we reached 3,295 patients, and we still maintained almost 100%. We implemented our actions were really effective. We gave our best shot. We tried to keep it going, and we will keep it going. And we plan to standardize and sustain these improvements. It's not over. We will go for it. We will continue, persevere, and achieve the goals.